Welcome back, friends. Today we are going to do a little recap about the muscles of the upper limb, and then later we can continue the different aspects of the muscles of the upper limb. So in the previous session we discussed about the muscles of the upper limb, but as I told you that the previous notes which I used, they did not explain about the muscles of the back. So today we will go through the muscles of the back, and then we'll see other aspects about the muscles of the upper limb. So first, let's start our discussion by discussing with the muscles of the back. So in the back we have the superficial group, which has trapezius, latissimus dorsi, and levator scapulae. So trapezius, latissimus dorsi, levator scapulae, and the rhomboideus. These are the superficial group. In the deep group we have the erector spinae, spinous, and the thoracolumbar fascia. So don't worry about this because we'll see them later in the diagram. So don't worry about this. For example, this is the trapezius muscle, and this is the latissimus dorsi, while here above we'll have the levator scapulae. But in the deep group we have the muscles like this one, and we'll discuss all of this in the next diagrams. Also we have the muscles in the thorax. We have the extrinsic muscle, which are pectoralis minor, pectoralis major, minor, and serratus anterior. Pectoralis minor and major we discussed them in the thorax, but the serratus anterior tuliona kwamba ndio hii hapa. So serratus anterior na kwa ndio hii hapa muscle ndio serratus anterior. This is the pectoralis minor, na hii hapa iliyokatwa hapa ndio pectoralis major. So pectoralis major ndio inaonekana hapa, tukicut inside na kuja kupata pectoralis minor, which is this one, and this is the serratus anterior, na ndio hii hapa serratus anterior. Hii hapa innervated by the long thoracic nerve. But in the intrinsic muscle of the thorax we have the intercostal staples externi, intercostal staples interni, and intercostals intimi. We'll discuss them in detail in the thorax. But about the major muscles of the trunk, first let's start discussing with the trapezius muscle. The trapezius muscle, its origin is in the superior neutral line, and unachoweza kuona ni kwamba trapezius muscle yenyewe ina origin nyingi, haina origin moja. So its origin inakuwa kwenye superior neutral line, external occipital protuberance, then ligamentum, neutral, and superior processes of the seventh clavicle and all thoracic vertebra. Kuona kuanzia the seventh cervical vertebra up to the all cervical vertebra, huku nyuma zinakuwa zinafanya origin ya nani? Ya trapezius muscle. So trapezius muscle kutoka pale juu mpaka huku chini, yeye yote hapa ametawala. Tunapofanya dissection of cadavers, tunavyoanza ku dissect cadavers, kule nyuma tu tukifunua skin tunakutana nani? Na trapezius muscle innervated by the accessory nerve. So it is a very important muscle. Usipoijua mwanzoni kabisa unapo dissect cadavers utaanza kuchanganyika kwamba what is this, where is the origin, where is the insertion. If you don't know about this, it will be very difficult for you. But if you understand this basic concept, it is very easy for you to grasp concepts on your cadaver dissection. Also in the insertion, it is inserted on the lateral third of the clavicle. So it is insertion on the clavicle, acromion, and spine of scapula. In terms of action, the action of this muscle, we have the upper fiber tend to elevate the scapula, lower fiber tend to depress the scapula. If the scapula is fixed, one side acting along draws head towards the same side and turn the face the opposite side. Both sides together draw head directly backward. Kwa mtu anapokuwa anainua kichwa kwenda nyuma, muscle anayokuwa anafanya kazi pale ni scapula. I mean muscle inayokuwa inafanya kazi pale ni trapezius muscle. Kwa trapezius muscle ndio ambayo inakuwa inafanya kazi mtu anapokuwa anainua kichwa kwenda nyuma. So it is trapezius muscle. Kwa unaweza kuona kwamba upper fiber ina elevate, lower fiber ina depress. Ikiact one side inakipeleka kichwa kwenye upande huo, na unavogeuka kwenda kushoto kulia, hiyo ni action ya nani? Ya trapezius muscle. Now let's move to latissimus dorsi. Kama unavyoiona hapo latissimus dorsi ilivyo, pale ambapo imeishia trapezius inaanza latissimus dorsi kwenye hizo spine of scapula. So origin is spinous process of the lower 6 thoracic and all lumbar vertebra. Kwa kuanzia vertebra ya 7 kushuka chini mpaka ya 12 kwenye thoracic vertebra imekaa latissimus dorsi pamoja na all lumbar vertebra have then median sacral crest and posterior part of iliac crest. Huko kote ni origin ya nani? Ya latissimus dorsi. Kwa kuna sehemu ambapo latissimus dorsi na trapezius zimeingiliana mpaka ukate trapezius uitoe, ndio utaiona latissimus dorsi vizuri kama unafanya dissection of cadavers. So in terms of insertion, imekuwa inserted kwenye floor of the intertubercular groove of the humerus. Insertion yake ni floor of the intertubercular groove of the humerus, na hiyo tumeshaiona sana kwenye osteology of the upper limb, kwenye bones of the upper limb. I hope you understand it, and there are no questions or any queries with this. So in terms of the action of the latissimus dorsi, trunk fix it tend to fix the trunk in its position. It extends the trunk, abducts and medially rotates arm, and it tend to elevate the trunk. So different movements of the trunk, they are regulated by this muscle, by the contraction and relaxation of this latissimus dorsi muscle. From there we have the levator spinae. Levator spinae, these are the muscles of the deep groups of the back. Na unaweza kuona kwamba levator spinae ni hizo muscles ambazo ni za ndani. Zenyewe kwa nje hauwezi ukaiona mpaka uingie ndani. So for example in this diagram unaweza kuziona hizi muscles ambazo zimelani perpendicular. So position, they fill the vertebral groove on each side of the spine. So kama kuna vertebral groove na kuna vertebral groove, anafill vertebral groove. Action, they extend the vertebral column, draws head backward. Lakini uone tujakutajia origin na insertion of these muscles, manake they are somehow complicated, very long muscles with the very long fibers from top then to downward this way. And tusipotaja origin na insertion, manake it's not so much important for you to understand the origin and insertion of these muscles, but what is important for you to know is just their action and their position. Then you have the pectoralis major, which is the muscle of the chest. Origin is medial half of the clavicle, sternum, and 1/3 to 6th costal cartilage. Insertion ni crest of the greater tubercle of humerus, na action yake ni kuflex, abduct and rotate the arm medially. Arm fix the elevate trunk and elevate the ribs. Pia inasaidia katika kufanya force ya inspiration. So hizo zilikuwa ndo muscles ambazo tulikuwa discuss, lakini hizi muscles nyingine of the upper limb, all of these we have already discussed them, the superficial and the deep groups in the different compartments. But as you can see, in the muscles of the hand also tulikuwa discuss. Tuna kwa mfano lateral group, they are called as thenar, they are 4. In the lateral group we have thenars. So kwa mfano huku ndio lateral, tuna ngapi? Tuna thenar ziko nje, ziko 4. Hii thenar zinaitwaje? Kuna abductor pollicis brevis, flexor pollicis brevis, opponens pollicis na adductor pollicis. They are called thenas, lateral group. I mean this is not lateral, this is medial, because hii ni minimi, so this is medial kwa sababu in the anatomical position huko ndo lateral. So we have the thenar muscles which are here. Thenar muscles are here and they perform different movements of the thumb. So we have the abductor pollicis brevis, flexor pollicis brevis, opponens pollicis, then adductor pollicis. They are present here. So function of abduction and adduction of this thumb, they are done by these four muscles called thenar. And then in the medial group, kwenye hichi kidole kidogo tunakuwa tuna hypothenar. They are 3. Kwa huku tuna thenar muscles ambazo ziko 4. In the hypothenar group tuna muscles ambazo ziko ngapi? Ziko 3. So hypothenars they are 3. Tuna adductor digit minimi, flexor digit minimi brevis and opponens digit minimi. Kwa unachoweza kuona the major difference ni kwamba huku ziko 4 na kwenye 4 za huku kuna pia nani? Adductor. Huku hatuna adductor. Huku kwenye adductor hayupo, yuko tu abductor, sio adductor. So we have the abductor pollicis brevis and abductor digit minimi, but we have adductor pollicis. We don't have adductor digit minimi. We don't have that. So in terms of action, the thenar, they tend to flexi, abduct, adduct and oppose the thumb. But in terms of action of the hypothenar, they tend to flexi, abduct and oppose the little finger. Also we have the intermediate group. Kwa tumeona hapo ziko muscles 7. Tuna intermediate group tuna lumbricals ambazo ziko 4. They flex fingers at metacarpal joints, extend fingers at interphalangeal joints. Kwa lumbricals ziko 4 hizo. Unaona ndio muscles zopo zimeonyeshwa hapo. We have the palmar interossei. Palmar interossei ziko 3. They tend to adduct fingers towards middle finger. Adduct finger towards middle finger. They are called palmar interossei. And then from there we have the dorsal interossei. They adduct finger away from the middle finger. So dorsal interossei, they abduct fingers away from the middle finger, while the palmar interossei they adduct. So the function performed by the palmar interossei and the dorsal interossei, they are opposing each other. They are antagonistic in action. Palmar interossei and the dorsal interossei, they are antagonistic in their action, while the action of lumbricoides, which are 4 in group, they do not interact with these palmar and the dorsal interossei. So actually this is just the summarization. So you can see we have 4 muscles. We have 4 muscles, then you have 3 muscles, then you have 3 muscles. They are almost 7. Then if you add, yeah, we have like, I mean they are almost like 10. Here they are almost like 10, and here like 17 muscles, is how we discussed in the previous session. So yeah, other muscles of the upper limb like deltoid, teres major, we have discussed them, biceps brachii. But one among the important things that I need you to note in this slide is the origin, insertion and action. Very important. Origin, insertion and action of every muscle. So I will be discussing the origin, insertion and action of every muscle by using these notes here. So I hope you can see what I'm projecting. However, to some extent it can't be 100% precise for you to see it, but I hope you can see. Now we are going to discuss about the muscles of the upper limb, and I want to discuss with you one muscle after another, one muscle after another. So let I just magnify it and then let I see how. So for example, let's start with the serratus anterior muscle. Serratus anterior muscle, and in this picture, yeah, I think you can see it. So let I do one thing here. It can simplify. Yeah, so for example, this is the serratus anterior muscle, and the origin of the serratus anterior muscle ni rib number 1 na number 8, na insertion ni medial border of the scapula. Insertion is medial border of the scapula, while in terms of the innervation long thoracic nerve, na action yake ni kurotate scapula lateral. Nimependa hizo notes kwa sababu zinaandika na innervation, ukicompare na other notes ambazo zenyewe zinakuwa haziandiki innervation ya huyo muscle. You see, for example, here we have the subscapularis muscle, origin yake ni rib ya kwanza, na huyo muscle mwenye nyekundu hapo ndo anakuwa muscle hiyo. Of then insertion inferior surface of scapula, action innervation hapo hata kama haijajazwa, lakini only for few muscles. Unaona, pectoralis minor muscle, innervation pectoral nerve, action protrusion, then origin, insertion. So I will share all of these notes in my blog, and I hope for your understanding of anatomy, you can go and you can see these notes. It will be very easy for you to learn and to perform well in your anatomy course. So let I finish my session here. In the next session, we'll be discussing about the blood supply of the upper limb and the clinical conditions associated with the blood supply of the upper limb. So thank you everybody, and let me wish you nice studies.